I'm Elise Faluco, and I'm the lead author in the study, The Brief Early Childhood Screening Assessment, Preliminary Validity in Pediatric Primary Care. As a child and adolescent psychiatrist, I'm really interested in promoting early identification and treatment of mental health problems, especially in young children. Now, behavioral and emotional problems are more common than you might think, with around 10% who have significant problems that cause impairment at home, at school, or in the child care setting. If identified early, these children could receive evidence-based treatments that could positively change the trajectory of their emotional and behavioral development. National organizations have recommended screening in the primary care setting. However, you have to keep in mind that primary care providers are very busy and have a limited time to screen in the context of a brief well visit. So what providers really need is a screening tool that's not only valid, but also brief. Now, our senior author, Dr. Mary Margaret Gleason, had previously validated a primary care screening tool called the Early Childhood Screening Assessment, or ECSA. It identifies children ages 18 to 60 months old with significant behavioral and emotional problems. And it has 36 items that caregivers can complete, and it's easy to score and simple to interpret. Now, our study team had previously shown that this instrument is feasible for use in primary care. However, some providers and caregivers said that 36 items is a long instrument to complete, while they're also supposed to be supervising their toddler or their preschool age child. As a mother of young children, I can completely appreciate that because I know how difficult it is to multitask when you've got a little one running around. So, taking all that information, what we decided to do is try to develop and validate a brief version of the early childhood screening assessment that's tailored for pediatric primary care. And our hope is that this brief screening tool might be more convenient and more widely used. So how did we do it? We collected 2,467 completed ECSAs from caregivers of children ages 36 to 60 months old in North Florida, which is where I practice. And then we performed a series of psychometric tests, and using these results, we ranked each of the 36 individual ECSA items on a scale from absolutely retain to absolutely delete. And then we sequentially deleted one item at a time, starting with absolutely delete, to create 35 shorter versions of the ECSA. So then we took these 35 shorter versions in a separate primary care population of 69 mothers of children ages 18 to 60 months old from Rhode Island and Louisiana. And we used these 35 versions to determine sensitivity and specificity for detecting a psychiatric diagnosis on the Diagnostic Infant and Preschool Assessment as the gold standard. And we decided to select the version with the best blend of sensitivity, specificity, and of course brevity as the brief ECSA. For our results, we found that a 22-item measure had a sensitivity of 89% and a specificity of 85% for detecting a psychiatric diagnosis. Now, we were really excited about these results because we believe that this brief ECSA is not only effective at identifying young children with behavioral emotional problems, it also should be more convenient for caregivers and primary care providers. And that helps our ultimate goal, which is to facilitate primary care screening with tools like the brief ECSA, so that more children with mental health problems can be identified early, receive the treatment that they need, and ultimately they can experience better outcomes and improve quality of life. I would finally like to take this opportunity to thank my co-authors, Tim Wysocki, Lauren James, Chelsea Kozakowski, Andre Williams, and Mary Margaret Gleason for their help with the project. I'd also like to thank the pediatric primary care providers as well as the parents and children whose data was used for this study. Thank you so much for taking the time to watch this video, and I hope you enjoy the article.